Food poisoning. Causes, symptoms, and management. Food poisoning is a common health condition that occurs when a person consumes contaminated food or beverages containing harmful bacteria, viruses, parasites, or chemical toxins. This condition can affect anyone, from children to older adults, and often results in uncomfortable gastrointestinal symptoms. Although many cases of food poisoning are mild and self-limiting, severe cases can lead to dehydration, electrolyte imbalance, hospitalization, and even death. Understanding the signs and knowing how to respond is essential for reducing complications and promoting recovery. Causes of food poisoning. Food poisoning can result from a variety of sources. Bacteria and viruses. Common bacteria include Salmonella, Escherichia coli, E. coli, Listeria, and Campylobacter. Viruses such as norovirus are also frequent causes, leading to vomiting and diarrhea. Parasites like Giardia lamblia and Cryptosporidium can contaminate water or improperly cooked foods. Chemical contaminants. Pesticides, heavy metals, lead, mercury, and excessive preservatives in food can lead to poisoning. Natural toxins. Some foods naturally contain toxins, such as moldy grains, fish high in histamine, or sprouted potatoes, which can induce food poisoning if consumed. Cross-contamination and improper storage. Food that is left at room temperature for extended periods, improperly stored, or comes into contact with contaminated surfaces can harbor pathogens that cause illness. Common symptoms. The onset of food poisoning can range from hours to several days after consuming contaminated food. Common symptoms include diarrhea, often the first symptom, sometimes with mucus or blood, nausea and vomiting, the body's response to eliminate toxins, abdominal pain and cramps, caused by inflammation of the digestive tract. Fever and chills. The immune system's reaction to pathogens, fatigue and dehydration. Due to fluid loss from diarrhea and vomiting, severe cases may include difficulty breathing, rapid heartbeat, or loss of consciousness, which require immediate medical attention. Immediate management of food poisoning, prompt and appropriate management, can prevent serious complications. 1. Remove contaminated food and induce vomiting, if advised, in some cases. Inducing vomiting may help remove toxins. Only do this under medical supervision or follow professional guidance to avoid complications. 2. Rest and safe positioning. Rest in bed with the head elevated to prevent aspiration of vomit. Infants, children, and elderly individuals should be monitored closely. 3. Rehydration and electrolyte replacement. Dehydration is a primary concern in food poisoning. Drink water, oral rehydration solutions, ORS, or diluted fruit juice. Avoid caffeinated or alcoholic beverages, as they can exacerbate dehydration. 4. Monitor for severe symptom. Seek medical care if there is persistent high fever, bloody diarrhea, difficulty breathing, or signs of shock. Continuous observation is essential to ensure stable recovery. Recommended foods during recovery. After initial treatment, the focus should be on easy to digest, nutritious foods to restore strength and digestive function. Soft, gentle foods. Rice porridge, oatmeal, soft soups, mashed potatoes, soft fruits like bananas, cooked apples, or pears. Foods rich in electrolytes. Yogurt, mashed potatoes, coconut water. These replenish minerals and fluids lost through diarrhea and vomiting. Mild proteins. Steamed chicken or lean fish. Support muscle repair and immune function. Probiotic-rich foods. Yogurt, kefir, sauerkraut, and fermented vegetables. Help restore gut microbiota and improve digestion. Foods to avoid during recovery to allow the digestive system to heal. Avoid fried, greasy, or spicy foods, processed foods and those high in sugar, caffeinated or alcoholic beverages, hard-to-digest foods such as raw beans, popcorn, or high-fiber raw vegetables. Preventing food poisoning. Prevention is always better than treatment. Key measures include food hygiene: wash fruits, vegetables, and hands thoroughly before eating or preparing meals. Regularly clean utensils, cutting boards, and kitchen surfaces. Proper cooking: ensure meat, eggs, and fish are cooked thoroughly. Avoid leaving perishable foods at room temperature for extended periods. Safe food storage: refrigerate or freeze perishable items promptly. Leftovers should be stored at below 4 degrees Celsius and consumed within 1 to 2 days. Choose safe food sources. Purchase foods from reputable sources. Avoid expired or visibly spoiled products. Include fermented foods such as yogurt, kimchi, and pickled vegetables can balance gut microbiota and enhance resistance to harmful pathogens. Understanding the gut immune connection. Emerging research highlights the relationship between diet, gut microbiota, and immune health. The gut hosts trillions of microorganisms that interact with the immune system. A diet rich in probiotics and fibers can enhance gut barrier function, reduce inflammation, and improve overall immunity. Individuals recovering from food poisoning may benefit from prebiotics, fibers, and probiotics to accelerate recovery. Special considerations for vulnerable populations. Certain groups are more susceptible to complications. Infants and young children. Rapid dehydration can occur. ORS and frequent small sips of fluids are essential. Elderly individuals often have weaker immunity. Early medical evaluation is recommended. Pregnant women. Certain foodborne pathogens, such as listeria, pose risks to the fetus. Avoid unpasteurized dairy, undercooked meat, and raw seafood. Individuals with chronic conditions, people with diabetes, kidney disease, or compromised immunity need close monitoring and may require medical intervention even for mild symptoms. Long-term recovery and nutrition tips after an episode of food poisoning. Proper nutrition supports gut health and immunity. Hydration. Continue to drink water and electrolyte-rich fluids. Balanced meals. Incorporate lean protein, complex carbohydrates, and healthy fats. Small, frequent meals help the digestive system gradually return to normal. Avoid irritants. Minimize spicy, fried, or highly processed foods for at least a week. Gradually reintroduce fiber. Start with soft fruits and cooked vegetables, then progress to raw vegetables and whole grains. Conclusion: food poisoning is a common but preventable condition. Recognizing the symptoms early, applying proper first aid, rehydrating adequately, and consuming easy-to-digest, nutrient-rich foods are crucial for recovery. Maintaining good food hygiene, proper storage, safe cooking practices, and inclusion of probiotics can prevent recurrence and support long-term gut and immune health. By combining awareness, prevention, and recovery nutrition, individuals can reduce the risk of complications, ensure faster healing, and maintain optimal health for themselves and their families.